Good evening. How many of you have been wondering what is functional medicine? Like, what is Dr. Mian talking about? And then I say, oh, well, it's root cause medicine. And then also sometimes you might wonder, well, what does that mean? I wanted to share with you an example that I came across recently that really illustrates very well what this means and why I love this approach to medicine and why I'm committed to supporting my patients with this. So recently I had a discovery call with someone. It was a 20-minute discovery call. And she was pretty distraught because she had just been given a diagnosis of fibromyalgia. And she's in her 30s. You can imagine how that must feel. She was also told that basically you have this thing, there's no cure, here's some medicine. And she said, I felt hopeless. I felt like there was no hope. I talked with her, and I explained to her that number one, what is fibromyalgia? Is there a blood test that you can just do this blood test and it says, oh, yes, you have fibromyalgia? That's not the case. It's actually what we call a diagnosis of exclusion in a way. It does have certain criteria. So you have to have pain and tenderness in a certain number of areas in your body. And there's a few other like inclusionary criteria, things that, people will say, okay, this is fibromyalgia. But really, the underlying issue is there's a lot of inflammation in the body that's going on. And that's where we look at the root cause. We ask the question, what is causing this inflammation? And of course, inflammation can be caused by so many different things. I've talked a lot about the gut. We look at the gut. Is there dysbiosis? Meaning, is there an imbalance of the bacteria in the gut that's not favorable? We call this dysbiosis. Is there a lot of stress going on? Stress affects the HPA axis. It affects the hormones in the body. So when I say HPA axis, I'm talking about the hypothalamic pituitary adrenal axis. And stress is very much affected by this. And this affects everything in our bodies. And then also we can look at, are there toxins or something else in the body that are accumulating and causing this problem? This often happens with people who have gut issues, for example, constipation, and they're not releasing toxins in that way. Oftentimes when I have patients who have a lot of these issues like this, I always ask about their gut. Like, are you having good bowel movements every day? And most of the time, people tell me, actually, I'm not. They could also have the opposite. They could be having too many. And so there's so many different things that underlie these diagnoses that really, if you look at it, can we get to what is causing that? Other things that we can also look at is sleep. How is this person sleeping? Is there neuroinflammation caused by other things such as poor diet, things like that. So I spoke with this person. It was less than 20 minutes, and she was shocked. She said, this gave me hope. And we didn't even talk for 20 minutes. You covered so much in 20 minutes. And this is what I'm sharing with you because this is the way I love to support people with their health. Once I saw this, I couldn't unsee it. It's very hard to, once you see something and it all makes sense. And also personally, I've experienced the changes in my own health using this approach. And so this is what I want to share with the world. I wish every single person had this knowledge and was able to use these principles to, reach optimal health. And I will talk with you again soon with more pearls and tips about my new journey. Take care.